Hi everyone, I'm Danielle with Promo Life, and today I have a special guest. It's Dr. Jess Peatross, and she's going to be talking to us a little bit about just some ozone therapy techniques and what she does and what she sees on a regular basis. Hi, Dr. Jess, how are you doing?
Oh, hi, thank you.
So we're just wondering, how long have you been practicing medicine?
So my gosh, it's been a journey. I graduated from internal medicine residency in 2009, and then I went straight into hospitalist work, which is a little bit of a newer specialty. It's getting more and more well steeped, but back then it was really new, and it was basically a doc that admits anything from the emergency department other than surgical emergencies. So I had to know something about everything. It was super busy.
Wow.
And yeah, I did all if there was a code in the hospital, I was responsible a lot of times. If admitting patients overnight and on call, all that kind of stuff to the ICU.
Wow.
So I did that for almost 7 years, and then really just started to notice things that started to be more and more off-putting to me. I noticed patients would be on, medicines they weren't supposed to be, up to like 6 years when they came into the
Wow.
hospital. And if I complained about it, I was being disruptive. And I would notice that they were feeding patients, oil and sugar and processed dairy in the cafeteria, these patients with cancer sometimes. And that also started to bother me. And the more I said, the more they would say, "You can't work for us if you continue to speak out." And so eventually I was in a position where I could just quit. I wasn't married, I didn't have kids. So I left and I started to shadow naturopaths. Now attended the Institute of Functional Medicine. I got trained under Dr. Frank Schellenberger's Ozone course. I also trained in Gerson therapy. Um, and really looked at all kinds of nutrigenomics and how functional medicine can help patients. So it's now been since 2015, 16, that I haven't practiced in the hospital, and I've gone straight into functional medicine and root cause medicine for people.
Wow, that's incredible. What an incredible journey. I mean, I'm so glad that it led you here. That's amazing. Yeah. So,
Right.
could you tell me a little bit, what is Gerson therapy exactly?
Gerson therapy is an alternative method for treating cancer. And it's basically the use of fresh juices every day, made every day, with a vegan diet, along with some animal based glandular supplements, and some other supplements based on Dr. Max Gerson's work, and then
Nice.
coffee enemas. And they were actually the ones who put me onto ozone therapy and started using ozone insufflations in their practice. And so that's what prompted me to go to Reno to Dr. Frank Schellenberger's course.
Wow. That's a really interesting. I love hearing about that. That's so cool. That's something that we hear from our customers a lot, that they, have done some Gerson therapy and such. So that's really interesting. Um, so I noticed that your Instagram is phenomenal, and you're so informative. Like, we love your stories. Everything that you post is just like, it's such great information, and I just noticed that we don't see too many people doing that, and we really appreciate it. I mean, it's a learning experience every day to just like click on Dr. Jess's page and check out what she's got going on in her stories and everything. And what we were just curious, just some of us here, what is one of the most frequently asked questions that you get?
Hmm. It's probably something not quite as exciting as what you would think. Really, like, I get a lot of women, because women, I really feel like, are leading a lot of the health changes and revolutions, and they're kind of dragging the men into it sometimes. Really, but so the women will ask, "Can I do anything if I'm pregnant or breastfeeding?" And it's
Yeah.
like so many of them are having children and then realizing, "Oh, I wish I'd been a little healthier. What can I do now? I want to protect my baby." And so it's probably some question like that. The other thing is, do you do one-on-one consultations?
Ah.
Yeah.
Yeah. And is that by chance the reason that you came out with your app, the W plus?
Exactly.
Awesome. That is
That's
such cool.
exactly why, because I was repeating myself every consult, right? And I thought, how can I get a broader stage and tell people who all need to hear this information? Feel like I could help more people, and I feel like they can be empowered to understand more about their bodies.
Absolutely. That's a genius idea. I'm so glad that exists. I mean, just knowing that that exists is a relief. I mean, really. So is it just like a paid subscription and you can pretty much ask Dr. Jess whatever you'd like?
Yeah, it's that and a little more. It's
Oh, wow.
so for 3 months we pay in quarterly sessions, and then you get access to educational videos, my biweekly or bi-monthly webinars that are each one is 2 hours long, and you can send in questions beforehand that I ask on the webinar, or there's a chat
Wow.
box. We also have our own community forum, so every couple days I pop in there and answer questions that people have under certain topics. So it's like your own Facebook group on your own webpage.
Oh my gosh.
And then
That's
I have one page PDF quickies where people can write in and say, I have this disorder. Can you give me maybe some holistic reasons and then some ways Western and Eastern medicine has shown to help it? And so these are suggestions when people write in. I'll make one for each person. So that's the app.
awesome. That is so great. I love that. We love that. Everyone here does. Yeah, honestly, I thought one of your questions that your frequently asked questions was actually going to be about mold, since you do have a lot of information about mold on your Instagram. So I just wanted to throw this at you. One of the things that I'd read recently in preparation for this interview was just that something about roughly 70% of homes have mold issues and in America. And that just struck me as like so much. Is that accurate?
Yeah, I think the actual set, it's pretty close. I guess it's rounded. If current houses have about 43% of them have current water damage, and previous and past water damage occurs in about 80% of houses. So
Wow.
yeah, so it is a significant problem. What does that mean that houses have had past water damage? You can't really quantify that or qualify that, based on that number, but it is worrisome because mold grows in as quickly as 24 to 48 hours.
Oh, wow.
Yeah.
That feels like everybody has mold pretty much. I mean, is that the case? Oh my gosh.
Have problems with how modern day houses are built. And
Hmm.
it's really, if we would build more close to what nature intended, we wouldn't have nearly the problems we're having now. We're really going against what nature intended, and that's where we're seeing problems.
Right.
Energy efficient houses are great for energy efficiency, but they're not great for airflow, which is how nature intended with natural buildings and things built into the earth. And also, we build houses with lots of volatile organic compounds and adhesives and really terrible things that we know damage our DNA. And so this also puts us in like a hot, stuffed mold box with chemicals, right?
That's what it sounds like. Ugh.
Yeah,
So
I wish I had better news about that. Yeah.
Ah, so we're basically setting ourselves up for this. I mean, in a lot of ways, right?
Sadly, it could be done so much better. We leave the elements, we build them out exposed to everything, right? The wood.
That's
Um,
true.
does it ever dry? These are my questions.
These are great questions. It's got me thinking about every single little thing now,
Oh,
which
all right.
no, that's a good thing. I think, it's whenever you don't question things, I think that, you have these problems that, that blindside you. So I think that it's a great thing to question these things. And I'm just curious, what are some common mold symptoms like to be aware of, to notice?
Great question, because mold it really damages our mitochondria and our livers first. So when you go straight for those organs, they can present in a lot of different ways depending on the person's genes. But in general, people are going to have shortness of breath because they're inhaling mold spores and hyphae into their lungs. They may have asthma-like symptoms. Even children may present with asthma, or they may have been potty trained and start bedwetting again, because mold inhibits something called antidiuretic hormone in the brain, which means people have to get up multiple times to go urinate, almost like a diabetic would have to sometimes. They may have these prickly static shocks on their skin, or almost like neuropathy type symptoms. They may have brain fog or difficulty with clarity of thought, heaviness. They may also even develop autoimmune conditions from living in chronic mold for so long without knowing. And really, think about what these are. These are just a label slapped on a constellation of symptoms. So mold can be a catch-all for many of these things we don't even think about.
Right. Wow. It sounds like it. I mean, a lot of those symptoms sound kind of similar to like Lyme and things like that. Does mold leave you susceptible to other illnesses and set you up for getting co-infections and things like that? Is that common?
For sure. I often see that people are kind of doing okay with their health. Maybe they're not stellar, but they're kind of doing okay. And they'll move into a moldy house and they'll be like the igniter of their other health conditions, because it spins the immune system out of homeostasis. It imbalances. If I was going to talk about the immune system very primitively, if there were two sides of it, there's one where T helper cells are made and one where T helper cells 2 are made. So Th1, Th2, and it swings it into more of a cytokine storm, a Th1 type of picture, which means that that's dominant and the other side is sort of neglected. So the Th2 side is what takes care of parasites. And so then you see your whole system is out of balance and you're more susceptible to other conditions. And actually mold is under the category of biotoxin illness, which also includes Lyme and some of its co-infections. So they are extremely similar. You're right.
That is interesting. Very interesting. Speaking of, I guess we can't really even talk about mold toxicity without hitting on a little bit of detox crisis and those types of reactions. First of all, just could you give us a little definition of like what is a detox reaction or Herxheimer's?
Exactly. Herxheimer, perfect. It's named, some guy figured this out and named it after himself. That's where that comes from. So basically Herxheimer is a healing detox reaction, like you said. And I think what modern science has done a poor job of is explaining to us why our bodies react this way. We think we should just take a pill and feel better. And that's really not the way that the body heals itself. If we're getting to the root cause, that's just a Band-Aid to make us feel better. So if we really want the body to see something, it has to activate the inflammation cascade a little bit. It has to see the problem. And sometimes when we start taking killing herbs or, something like ozone, which is really anti-pathogenic, then we have die-off symptoms from pathogens that are in our body, or heavy metals, other corporate man-made toxicities that our body is pulling out, especially if we're taking binders, we're sweating, we're doing all the other things to pull things out of our body. Then when the body sees it, it appropriately revs up the inflammation pathway and says, hey, there's a problem, make an army, go chase this out. And that's the normal way of healing. We just have to keep it tolerable and safe for people.
I love the way that you said that, when your body sees it. That's really descriptive. That helps to understand it a lot better. So would you say that like anyone can have this kind of reaction? Anyone can?
Everyone's a little bit different. Like for me, I'm not that person. No, I don't have really healing detox reactions unless, I had too much alcohol or something one day in my earlier years, but otherwise I don't. When I take, herbs, when I take a detox. So some people who have maybe chronic illness or autoimmunity, where they're just a little out of balance or their system's out of normalcy, it's kind of painful to open things back up, and they might be a little more susceptible to having those reactions. It's something that is commonplace that I talk to people about. It's very common and it's confusing to people. So it's really important that people are warned up front, and things are explained to them about what might happen when we start a detox.
Right, right. Yeah, I think it's good to know for sure that that's a possibility, especially. And so would you recommend, if somebody were having a detox reaction, would you recommend continuing with treatment, or stopping that treatment and allowing it to pass, or what would be your protocol?
That's the thing. If it depends, it's so bio-individual. It really depends on the person. There are some people who say, I have a headache, I break out in a rash, but I'm good. I'm going to keep going. I feel great. I'll go sweat in my sauna. My energy's okay. And you feel confident that they can handle it. There are other people who say, I have a headache, I've got a rash, I'm freaking out. This isn't normal. And in those people, I will back off with them. I very much believe in involving the patient in their care and understanding how they feel, because keeping them empowered and positive during something like this is just as important as the actual protocol.
Sure. Yeah.
Yeah. So it's really dependent. If you feel overwhelmed, I tell people, if you feel overwhelmed, if you feel like it's too much, you need a break, honor that, honor your body. You can cut the protocol in half. You can stop for a few days. You can see where your body falls by itself to see where you need to continue. Because even people who are super, they've maybe been triggered by some of their medical care before. If I'm able to, tell them eventually the pain of being sick will be greater than the fear of starting, but that's not for me to decide.
Wow. Yeah, that's wonderful. That's a wonderful way to go about it. I'm pretty sure I can speak for everyone when I say that we would love that from our doctor to, empower us and make us feel like we are part of this treatment and we are involved. I mean, that's part of the healing process. And I really appreciate that. That's wonderful.
I wish you'd see more of it,
Yeah, that would be really nice.
Yeah.
That would be really nice. So speaking of like with reactions and detox reactions and everything, I failed to mention the full moon cleanse. That's what everybody's been talking about lately. It's really popular. And could you just shed a little light on what that is and how long is that? Like, how long is this cleanse?
For sure. So, I have my favorite companies that I actually tout because I believe in their science and their products. But in general, what this is, the reason people talk about full moon cleansing, it sounds kind of like woo-woo science, but it's actually, there's real science behind it. So when there's a full moon in the sky, your body naturally produces less melatonin. That's the neuropeptide, neurohormone that helps you sleep at night, makes you get sleepy. But instead it produces a little more serotonin, and serotonin is the feel-good hormone in the right ratios, but it also helps to feed parasites. And so it makes them more mobile at night, almost like they're having a party. So people may have more muscle twitches or fasciculations because of that.
Wow.
They may have teeth clenching or jaw grinding, also known as bruxism, because the parasites are nocturnal. They usually wake up around 7 or 8 p.m. for their little evening party, especially around the full moon. And so it's a stress on the body. People clench their teeth at night because it's a stress when these things are moving around. I sometimes see dairy sensitivities having to do with parasites, and definitely headaches can be a sign of that too. There's quite a few signs actually, even not to be too gross, but anal itching can be one at night, especially around a full moon. So if that sounds like you guys, don't feel weird. Up to 70% of people we think have had parasites or do have parasites.
Wow, that's a lot.
It's a lot.
That's a lot.
Yeah.
So basically, we should all be considering full moon cleanses, right?
Our indigenous ancestors did that, Danielle. They really did.
Wow.
They cleansed, at least once a year, most of the time twice a year. And in other countries, if you go to the Southeast Pacific, they still remember to do these things. It's just in their tradition. And I do believe that our ancestors had some very telling and knowing science that behind this.
Yeah, absolutely. I mean, maybe it's some connection, more of a connection with their bodies, because there's not as much distraction as we have today. I mean, that could be part of it as well, but there's definitely something to it. It wouldn't be as popular as it is. And I know that you definitely wouldn't be such a huge fan of it if it weren't, definitely something we should be considering doing. I'm just curious, how long does a full moon cleanse usually take?
It's dependent on a person, right? If you just want to do a full moon cleanse, which some people like to try out before they dive right in, I really encourage people to be able to, make sure you're going to the bathroom okay, sweating okay. If you're not, then back up and try and open some of those drainage pathways with sauna work and lymph work and really getting your bowels going and your gut healthy. But jumping into a cleanse for the full moon, I usually keep people on it, a few days before the full moon and a few days after. And you can cycle that every month. There's also a way to just parasite cleanse for 3 or 4 months total. And if you're using natural products, they are safe to do that in most accounts. If you're using anti-parasitic prescription drugs, you should just follow what your doctor recommends.
Nice.
Yeah.
Oh, wow. So in any of these, and you're basically, we're talking about like enemas and things like that.
Yeah.
So when you're using these types of things, is it something that have you seen anyone or heard of anyone or recommended to anyone to use ozonated water with any of those enemas, or is that something?
Yes, absolutely. I usually start people with water enemas, and ozonated water enemas are amazing if people have a generator. It's the coolest thing ever. And it's really healing as well. And you guys may not know, but the rectal tissue actually has a lot of blood vessels. So it really can absorb, just as if you were getting an IV. The blood serum levels are very close, actually. So yeah, so it's a really great way if you don't want to get an IV and get stuck, but you have an ozone generator. It's a nice alternative.
Wow, that is really cool. So what is the benefit of using coffee for an enema? Just curious.
Coffee actually has been shown to increase glutathione levels. It also has some dilation properties and ability to dilate some of the veins and portal ducts and things, and increase bile flow because of that reason. So by increasing any sort of fluid in our body, that's when the body is able to release things. When things get thick and sludgy, it equals disease.
Right. That makes perfect sense. That's an excellent reason to use coffee as an enema. That's wonderful.
Yeah.
And transitioning a little bit into female health, is ozone therapy something that you would recommend for like female health specifically, and what types of applications do you typically recommend?
Yes, absolutely. And, you can also do vaginal insufflations of ozone too, if you have a generator, which is amazing. And I've seen it be super healing for lots of different pathogens, actually. Ozone is a pro-oxidant. It actually helps to hyperoxygenate the area. And a lot of different pathogens are killed that way. These studies have even shown it can inactivate viral envelope proteins, which kills viruses.
Wow.
So you can think about different pathogens, or if our flora is off down under, ladies, then what can you do to help out? Because there's going to be some microbes you don't want down there sometimes. And sometimes they can be pretty persistent. So if you don't have a generator and you're thinking, oh my gosh, what else can I use? There's also, I think, some amazing suppositories, which have oils with a diffused ozone inside of that. And they're really amazing and quick and easy, and not quite as daunting, right?
I agree. Yeah. My next question was definitely going to be like, okay, for those of us who are just a little bit afraid of the ozone, vaginal insufflation, what alternatives, and yeah, suppositories, ozonated suppositories are wonderful. They're really, really helpful with things like that. I just kind of wanted to touch on that a little bit, and also with ozone oils, are there something that you've tried before for different things? Or what are some things that you've maybe tried those with, or recommend to others?
So it's funny you ask. I went to the dentist today and they were like, oh, you have IL-6, which is a genetic predisposition to get inflammation in my gums. So I'm prone to like gingivitis, gum disease, which indicates inflammation in the body, the gut. You guys, this is really the gut. So it worried me. And they said, what we recommend for you to do is keep brushing, visit us in 4 months rather than 6 months, and get some ozonated oil rinses or an Ayurvedic oil rinse. And so I'm so excited because you guys obviously have an ozonated oil rinse
We
that
do.
I have been now prescribed by my dentist. So
And
yeah.
we're so happy to get to send that to you.
Yeah, absolutely. If you guys don't know, dentists use ozone too in the mouth to get rid of all kinds of pathogens, especially if there's some sort of infection. And it works wonders as long as you change your habits with it too. It's wonderful.
Nice. Yeah, absolutely. Huge fan of our oil pulling solution and our tooth and gum. I think a lot of our customers are definitely. Well, that is about all that we have for today, but I so much appreciate you coming on to talk to me about this and that and everything that we discussed: ozone, Herxheimer's, Lyme, and mold, amongst other things. We're such huge fans of yours. And just to let everyone know to check Dr. Peatross out on Instagram, and Facebook, and everywhere else that she is, in her app as well, W Plus. And don't forget to check us out as well, promolife.com and Puro3. Thank you so much, Dr. Jess. You're the best. And happy International Women's Day.
Thank you so much for having me. I really appreciate it.